Good afternoon, everyone. I am Dr. Mayank Agarwal, consultant gastroenterologist and hepatologist at Ayurveda Super Speciality Hospital, Guwahati. Today, I'll be talking about a very important topic: non-alcoholic fatty liver disease. It is a very common problem in today's world. Normally, liver contains less than 5% fat. There are situations when this amount of fat in the liver may increase, and this condition is known as fatty liver disease. Fatty liver disease is also seen in alcoholics. So, non-alcoholic fatty liver disease is fat in the liver in the absence of significant alcohol consumption. Non-alcoholic fatty liver disease is a spectrum of diseases and includes plain steatosis, or what we know as fatty liver disease. It can result into inflammation in the liver, which we call it non-alcoholic steatohepatitis. This can further result in cirrhosis of the liver and even liver cancer or hepatocellular carcinoma. So as you see, this disease can have serious implications for us. So what are the risk factors and whom should we suspect to have fatty liver disease? The most important risk factor is obesity. People who are obese, who have central obesity, usually have excess fat in the liver. The main indicators for this are unhealthy lifestyle, which includes lack of any activity, that is a sedentary lifestyle, bad eating habits, more consumption of fat, less consumption of fibers, plus patients who are diabetic, who have dyslipidemia or abnormal cholesterol and triglyceride levels, are also prone to develop fatty liver disease. There is a term which we use which combines all of things together and is known as metabolic syndrome. Here the patient is obese, may have hypertension and or diabetes and dyslipidemia. These patients are prone to have fatty liver disease and its associated complications. So, how do we diagnose such patients? Well, diagnosis is pretty straightforward. First, we come to the symptoms. The symptoms are very non-specific. Some patients may develop non-specific abdominal pain. However, most of the patients are asymptomatic and they come to the physician only when a random ultrasound shows some fat in the liver. However, as I said earlier, not all fat in the liver means the patient has serious liver disease. Usually, we evaluate such patients with a liver function test. In patients with non-alcoholic steatohepatitis, that is inflammation of the liver, LFT may be abnormal, manifested by raised AST and ALT. If we find this thing, we usually have to rule out other common causes of transaminitis or raised AST and ALT. These include hepatitis B, C, and alcohol consumption. Once we have ruled this out, we need to establish whether the patient has diabetes or impaired glucose tolerance. We typically do a fasting blood sugar and a HbA1c for this. After that, we need to check for the fasting cholesterol levels to see if the patient has existing dyslipidemia. Moving on to the treatment. Treatment usually involves lifestyle modification. It has two components: diet and activity. To keep it very simple, I suggest my patients to avoid excess fat and carbohydrates while increasing their consumption of fibers in the food and maintaining a healthy protein intake. Things to avoid include excess ghee, butter, oil, deep fried food, fatty food, ice cream, biscuits, cakes, and decreasing the amount of carbohydrates. The principal amount of carbohydrates that we consume are rice and roti or chapati. Protein intake should be adequately given to the patients. Activity, we usually advise patients 30 to 45 minutes of activity. Any activity that they like, walking, running, swimming, cycling, whatever they can do. They can build it up gradually. What we advise through these two things, that is diet modification and activity, we are trying to induce weight loss. A weight loss of approximately 7 to 10% is advisable in patients with non-alcoholic steatohepatitis to prevent further complications. Moving on to drugs, there is very limited data regarding drugs in patients with non-alcoholic fatty liver disease or NASH. We use vitamin E, which is an antioxidant. This has been shown to reduce inflammation in the liver and thereby improving steatohepatitis. In patients who have coexisting dyslipidemia, we can use saroglitazar. In patients who are cirrhosis, we usually manage it according to any other liver cirrhosis, be it alcohol related or hepatitis B related. So, as I say, non-alcoholic fatty liver disease encompasses a whole spectrum of diseases, the main risk factor of which is obesity, sedentary lifestyle, and bad eating habits. Treatment mainly involves induction of weight loss through dietary modification and increased activity. Drugs till date have a limited role in the management of non-alcoholic fatty liver disease. However, a number of research trials are going on to address this issue. So, eat healthy, stay healthy, and avoid fatty liver disease. Thank you.